And welcome back to Noon Edition. Tami Gough of the Allen County Health Department is here, and we're going to talk about opiate addiction and how big of a problem is that here in Allen County?
Well, unfortunately, it's starting to creep back up there. In the early 2010s, between 2010 and 2015 is when it really was peaking and becoming a crisis across the nation, as well as in Ohio and here in our area. And a task force was able to be formed, headed up by the Mental Health Recovery Services Board, that brought together all different sectors, hospitals, health departments, schools, social service agencies. And we worked on several different projects that were able to tackle the problem. And we saw a couple of good years where numbers did go down in 2017 and 2018. But then the pandemic happened, and not only were people more stressed, but also services that typically helped these situations were taxed beyond anything we would have imagined. And so, unfortunately, we're seeing the numbers creep back up there again.
So what is being done to combat this situation?
The task force, the major projects that they were able to work on was getting some treatment beds. Withdrawal from opiates is not life-threatening. It's just extremely uncomfortable and very difficult to do on your own. So therefore, it wasn't usually handled in a medical setting. But the cooperation of the hospitals and Coleman Professional Services were able to put together some recovery beds so that people could be assisted through those horrible side effects of withdrawal. So that was a really big plus. But Allen County Public Health's involvement was we developed a Narcan program, where a Project Dawn program, where we distribute naloxone or Narcan in the community, which Narcan is a drug that the only thing it does is reverse the effects of an opiate overdose. It's not harmful by itself. It doesn't help with alcohol. It doesn't help with meth. It just works with opiates. So it is not dangerous to have around. It's the only thing it'll do.
So let's talk a little bit about Narcan. What exactly is it? And you said it just kind of reverses the effects.
Yep.
How is it distributed?
Well, you can get it now, what they say without a prescription, which actually means that you don't have to physically take a prescription to a pharmacy to get it. And programs like ours can distribute it, but we still are under the auspices of a medical director and a protocol for that. It's just as easier for the general public to get it. So our Project Dawn program has partners with both hospitals, with other agencies in town that help us distribute Narcan to people that need it. Anybody can have one. You don't even have to tell us why you want it, if it's for yourself, for a loved one. A lot of people get it because they either live or work in an area where they might come across someone that's experiencing an overdose, whether it's a parking lot or on their sidewalk. So they just want to have it available. It's very easy to use. You don't have to be any type of medically skilled to do it. The directions are easy, and it just reverses the overdose. Opiates suppress your respiratory system, so you stop breathing. And once you administer the Narcan, then that suppression goes away and you're able to breathe again. And Narcan is not the treatment. You still need to enlist 911 so that emergency services can come, because you still need medical care. The important thing it does is it just gets you breathing again so that you are less likely to die of the overdose.
So I'm in a parking lot and I see someone who is down, they're unresponsive. How do I know whether they are overdosing on an opiate or whether they have had some other medical issue? How am I going to know?
Well, you aren't going to know, but that's the good thing about Narcan. The only thing it does is reverse the effects of an opiate. So if you would give it and they didn't need it, it's not going to hurt them. So you might as well try if that's the tool you have. Because right now we don't have tools with us that we can use for other drugs that someone might be experiencing. But anybody can have Narcan and anybody can use it.
We talked earlier, Narcan does not expire, although it will have an expiration date on it.
Yes, the kits and the boxes of Narcan come with a date on it. I believe it's almost like a 2.5-year time shelf life now. If you happen to have an old kit, though, don't not use it just because it's out of date. If you need to use it, go ahead and give it a try. Sometimes I've heard some pharmacists say that, you know, it'll be all right for a while. You should just try and replace your kit if you know it has an expiration date that's occurred.
Tami, great information. Thanks for joining us this afternoon. We'll be back with more on medical news coming up next on Noon Edition.